There's a lot of research looking at bariatric surgery outcomes in adults. However, there are fewer data available for adolescents and children. And with me is Dr. Nestor de la Cruz-Munoz of the University of Miami. Thank you for taking the time to meet with me.
Well, thank you for having us.
And Dr. de la Cruz-Munoz, you did a study where you looked at the one-year outcomes for adolescents who undergo bariatric surgery, the morbidly obese. Can you talk about that, some of your main findings?
Sure. We looked at the Surgical Review Corporation's national database, which is based off of their Bariatric Surgery Center of Excellence program, and all the programs that are involved in that program submit data to that database. We were able to pull the national data, found that about 0.7% of all the procedures that were done on adolescents or people under the age of 20.
Wow.
It ended up being 890 adolescents in the database that started in 2007 and ended in October of 2010. That was our cutoff date. And when we started looking at them, we just wanted to look at the demographics and their one-year outcomes. We found out that the average age was about 18 and a half. The youngest patient was about 11 and a half that had surgery, so pretty young. It was about 80% girls and 70% and 20% men, which is about what we see in the adult population, with a mean BMI about 47, which is also what we see in the adult population. They were split about 50-50 for bands and bypasses, which is a little bit more bands than we see in the adult population, so that was a little interesting. And then when we looked at their one-year outcome, we found that basically the boys and the girls both decreased significantly their weight and their Z-scores for BMI and for weight, and brought them not down into the thin range, but at least more closer to the normal range. And again, these are only one-year outcomes. They're not long-term outcomes. And then we looked at the adverse events, found that the adverse events numbers were very low. The mortality in these kids was 0.11%. And so it looks like bariatric surgery can be an option for this group who's morbidly obese. A lot of them already have some of the comorbidities, at least in the short term. What we're going to need to do is look at longer term data, look at 2 years and 3 years, 5 years, 15 years, as that stuff starts coming out, so we can get a better idea of what's going on in the long term for them.
This has been Damian McNamara reporting from the Pediatric Academic Society's meeting in Denver, Colorado.